Now, as we know, it's been a busy winter for hospitals in the south, with Omicron affecting patient numbers and meaning more staff than usual are absent. The impact's being felt on the ward by medical staff and also behind the scenes. At Poole Hospital, porters, laundry and kitchen staff play essential roles in keeping things running. Our health correspondent Alistair Fee has been to see how they're coping.
As you can see, the linen guys just arrived to empty all of this, so this is probably, you know, as full as you'll see it in terms of linen.
It's like a swan. It's graceful on top, but we're kicking like mad underneath to keep it going.
This is what patients don't see, but their care depends on.
Not taking away from what the doctors and nurses do, they do a fantastic job. But without my team down here, and I've got a team of about 20 people, without them doing their job, the hospital will soon go into a halt.
Across the NHS, this has been one of the busiest weeks of the year. Admissions of patients with the Omicron variant was expected to reach a new high.
We've been kind of up to the rafters all the way along.
When beds in hospitals are full, it's first felt here.
Shepherd's pie, orange juice.
We need to keep the staff going, we need to keep the patients fed, we need to keep them, you know, if visitors are coming or going, everyone needs to eat, so we just need to keep it going.
In the community, the numbers of people testing positive for coronavirus is slowly starting to fall. But across the region, infections are still well above the height of the peak last winter.
Porters literally do anything non-clinical. If someone wants something, then it's down to us to try and sort it out. At the height of the pandemic, when it was pretty awful in terms of the deceased that we were handling on a daily basis, it just seemed to be never-ending. That's probably the memory I'll take from the pandemic, from the bad days.
While new COVID admissions might well have peaked, there are still many different demands on the NHS that will keep all teams on their toes.
The focus is on the wards and on the nurses and the doctors who do an amazing job. But there are our guys that are in the background, they're moving on the patients, they're doing all the waste, anything and everything, and they get so forgotten. And I've always kind of felt sorry for that, you know, they really do deserve the praise for what they do.
It is tense. I'm not saying I've got a few more grey hairs, but yeah, it is very tense. I've got guys in my team in there. I've got one guy who's had long COVID for a year. He's still in every day at the moment. I've got guys in there who save people's lives out on the wards. Things like that, just doing their normal jobs. It's, yeah, I work with a great bunch of people.
As restrictions introduced to curb the Omicron wave are eased, the ongoing risks will be determined by how careful we all continue to be. That will influence the pressure felt throughout our hospitals over the coming weeks. Alistair Fee, BBC South Today.